Staff at the Lolobi Health Center in the Oti region are urging for a renovation of the facility, which serves over 1,000 people in the area. According to the staff, the health center is in a deplorable condition, endangering both their lives and those of the patients. They're calling for immediate action to address the situation. ChannelOne News' Desmond Salasiago reports.
This is the current state of the Lolobi Health Center. Health workers who guided the ChannelOne News team noted that the situation is worsening. Large cracks are visible on the walls, raising concerns about the building's potential collapse, especially during the rainy season. Sachibu Abdul-Baki, a senior nurse at the Lolobi Health Center, spoke to ChannelOne News.
So many years, there haven't been any major renovations. And as you can see, there are cracks on the buildings. And then it's exposing dangers to our clients and we, the health workers, ourselves. So we want the stakeholders, the governments and other community members to come to our aid to at least to put the structure in a good condition that will relieve the danger to ourselves as well as our, our clients as well.
Patients often have to sleep on benches and makeshift beds due to the lack of adequate beds at the facility. The center has only about 5 beds, which are insufficient to meet patients' needs. Sachibu Abdul-Baki addressed the issue of bed shortages and other medical necessities at the health center.
We only have one detention room with one detention bed, which serves the whole community as well as the neighbor communities. So in case there's a case that we need to detain, and it is more than one case, one person will occupy the bed, then the rest of the patients, we have to find some places to adjust them so that at least we can be able to manage them. And if we realize that the case is beyond us, we can get results as quick as we want, we need to refer it to Volta Regional Hospital.
Furthermore, staff accommodation is inadequate, leaving many staff members without proper housing. They are appealing to authorities for support for both the staff and the health center.
We only have one accommodation which was built by the community in partnership with European Union also for some years back, which is housing only 3 staffs. And it is not even enough for them. They are just adjusting so that at least when somebody comes in the night or any time at the moment, they can get access to the staff to be able to provide them with the basic health care. And the community is also trying as much as the community is also trying very hard to provide us with another bungalow here, which is at the lentil stage. That at least when they are able to complete it, it will serve us very well, because most of the are renting in town.
During a fundraising festival, some residents of Lolobi also called for urgent improvements to the facility. Staff here at the Lolobi Kumasi Health Center are calling on authorities to, as a matter of urgency, improve their health facility and also bungalow for them to help improve service delivery. Reporting for City News from the Lolobi Kumasi Health Center here in the Grand District of the Oti region, I'm Desmond Salasiago.
In the Sanarigu municipality in the northern region, a significant number of junior high school girls are facing increased absenteeism due to inadequate water, sanitation and hygiene facilities, particularly during their menstrual cycles. This alarming trend underscores the urgent need for improved wash infrastructure to support the educational and health needs of adolescent girls in the region. Our northern regional correspondent, Shawana Yusuf, has more.
A recent survey conducted by the Sanarigu Municipal Education Directorate reveals that over 60% of junior high school girls in the municipality miss school during their menstrual periods due to the lack of proper wash facilities, the absence of clean and private toilets, insufficient water supply, and the lack of menstrual hygiene products are the primary factors contributing to these issues, which is impacting the country's quest to achieve sustainable development goals 4 and 6 related to education and wash. At the Kasalgu Zion Junior High School and Nangbao Junior High School, the situation is particularly dire. These schools, which cater to hundreds of students, have only a functioning urinal, which is often in poor condition. The lack of clean and private sanitation facilities forces many girls to stay home during their menstrual cycles, missing crucial instructional time. Another student at Kasalgu disclosed they are forced to practice open defecation whenever nature calls. Some of the students shared their ordeal.
This is our bathroom. We don't have standard bathroom in our school. Sometimes if you want to free yourself in this room, you don't know how to do yourself, because when you are in there and someone just passing, that person will looking at you, and it's not good for each and everyone.
Our bathrooms do not look conducive enough. The structure is almost fallen, which is very bad. And any time, any day, it can even fall. It could be that a person may even be in there when it falls, which will be very bad. And as the structure is not very conducive and clean, which is unhygienic for us and can cause diseases for us.
During our menstruation, we cannot enter inside. Just like one day it have ever happened to me like that, which I have to go to my friend's house to change myself.
The school health education program chef coordinator at the Sanargu Municipal Education Office, Hajia Ruka Al Hassan, provides a breakdown of the situation in the municipality. Hajia Ruka noted that 75% of junior high schools in the municipality are without standardized wash facilities, significantly affecting teaching and learning among girls. She further revealed that some adolescent girls resort to the use of baby diapers due to their inability to afford sanitary pads monthly, which could impact their health.
We have issues of the sanitary pads. Most of the girls are not able to afford the sanitary pads because it's beyond their capacity. So they result into using the baby diaper as a way of subsidizing the sanitary pad, because that one is cheaper. You can get one at 1 cedi, and it will keep them within the hours of 8 to 2 till they go home. And we are not encouraging that because it can also lead to infections.
A health lead expert at NOSAC, Blesla Nafoy Kando, told City News that the limited institutions with wash facilities are not gender-friendly and lack sanitary products to make life comfortable for the girl child. She made an appeal to the government through the various MMDCEs to ensure that the design of educational facilities includes a gender-friendly wash component before its approval.
Even in schools that we have wash facilities, they are not gender-friendly. And once they are not gender-friendly or gender-sensitive, it means that we are limiting access to wash facilities by girls, especially during their menstrual period. We need to prioritize having gender-friendly wash facilities in school. And this includes working closely with the district assemblies to ensure that in the design of any educational facility, whichever contractor is going to be developing, that has to ensure that the wash facility in that school be gender-friendly or gender-sensitive before it is even approved and then gone out to be carried out.
In the Sanargu municipality, a significant number of junior high school girls are facing increased absenteeism due to inadequate water, sanitation, and hygiene facilities in their schools, most especially during their menstrual cycle. When these facilities are made available, it will go a long way to improve access to education and health for these adolescent girls in the northern region. For City News, my name is Shawana Yusuf, reporting from the northern region in the Sanaragu district.